Hemophilia is a rare, inherited bleeding disorder characterized by the blood's inability to clot properly. This condition leads to prolonged bleeding or spontaneous bleeding episodes, which can be life-threatening if untreated. Hemophilia primarily affects males, as it is usually inherited in an X-linked recessive pattern. Causes and genetics. Hemophilia is caused by a deficiency or malfunction of specific clotting factors, which are proteins in the blood essential for blood clot formation. The two most common types of hemophilia are Hemophilia A, caused by a deficiency of clotting factor 8. Hemophilia B, also called Christmas disease, caused by a deficiency of clotting factor 9. Both these factors play critical roles in the coagulation cascade, a series of reactions that lead to blood clot formation to stop bleeding. The disease is usually inherited. The genes responsible for factors 8 and 9 production are located on the X chromosome. Since males have only one X chromosome, XY, inheriting the defective gene results in the disease. Females have two X chromosomes, XX, so if one X chromosome carries the defective gene, the other can often compensate, making females carriers without symptoms, although some female carriers may show mild symptoms. In rare cases, hemophilia can occur due to spontaneous mutations without any family history. Symptoms and clinical features. The severity of hemophilia depends on the amount of clotting factor present in the blood. Severe hemophilia, 1% of normal clotting factor activity. Moderate hemophilia, 1 to 5% clotting factor activity. Mild hemophilia, 6 to 40% clotting factor activity. People with severe hemophilia tend to have spontaneous bleeding episodes, while those with mild forms may only bleed excessively after surgery or injury. Common symptoms include excessive bleeding from cuts or injuries. Even minor injuries can cause prolonged bleeding. Spontaneous bleeding, especially into joints, muscles, and soft tissues without apparent cause. Joint bleeding, hemarthrosis, bleeding inside joints such as knees, elbows, and ankles is the hallmark of hemophilia. This causes swelling, pain, and limited mobility. Repeated joint bleeding can lead to chronic joint damage and arthritis. Muscle hemorrhages, bleeding into muscles can cause pain, swelling, and can compress nerves and blood vessels, leading to complications. Easy bruising, patients bruise easily with little trauma. Bleeding after surgery or dental work, without proper treatment, bleeding may be difficult to control. Severe bleeding in the brain, intracranial hemorrhage, or internal organs can be life-threatening and requires immediate medical intervention. Diagnosis. Diagnosing hemophilia involves a combination of clinical evaluation and laboratory tests. Family history and clinical presentation. Doctors assess the patient's bleeding history and family history of bleeding disorders. Blood tests. Coagulation factor assays. These measure the activity levels of clotting factors 8 and 9 to confirm the diagnosis and determine severity. Activated partial thromboplastin time, APTT, usually prolonged in hemophilia. Platelet count and bleeding time, usually normal in hemophilia. Genetic testing can identify specific mutations in factor 8 or 9 genes and is helpful for carrier detection and prenatal diagnosis. Treatment. Hemophilia currently has no cure, but it can be managed effectively with proper treatment and care. The main goal is to prevent bleeding episodes and manage bleeds promptly to avoid complications. Treatment options include replacement therapy, the cornerstone of hemophilia management. Patients receive intravenous infusions of the deficient clotting factor, factor 8 for hemophilia A and factor 9 for hemophilia B. These can be plasma-derived or recombinant, synthetic, products. On-demand therapy, given at the time of bleeding episodes. Prophylactic therapy, regular infusions to prevent bleeding episodes, especially in severe cases. Desmopressin, DAV, a synthetic hormone used in mild hemophilia A, which stimulates the release of stored factor 8. Antifibrinolytic medications, help prevent clot breakdown in cases of mucosal bleeding. Gene therapy, emerging experimental treatments aiming to introduce a correct copy of the defective gene into the patient's cells to produce the missing factor. This offers hope for a long-term cure. Complications. If left untreated or poorly managed, hemophilia can lead to serious complications such as chronic joint damage. Repeated hemarthrosis can cause joint deformities and disability. Muscle contractures, from repeated muscle bleeds. Life-threatening hemorrhages, such as brain bleeds or internal organ bleeding. Development of inhibitors. Some patients develop antibodies, inhibitors, against infused clotting factors, making treatment less effective. Psychosocial impact. Chronic illness and activity restrictions can affect quality of life and mental health. Living with hemophilia. With modern treatment advances, people with hemophilia can live near normal lives. Early diagnosis, access to treatment, and preventive care help reduce bleeding episodes and complications. Patients are advised to avoid activities with high injury risk, maintain a healthy lifestyle, and work closely with hematologists and specialized hemophilia treatment centers. Conclusion. Hemophilia is a lifelong bleeding disorder caused by deficiency of clotting factors 8 or 9. Its hallmark is prolonged bleeding, spontaneous joint and muscle hemorrhages, and potential severe complications if untreated. Thanks to advances in replacement therapies and emerging gene therapies, individuals with hemophilia today can expect better management, reduced complications, and improved quality of life. Awareness, early diagnosis, and ongoing medical care remain essential for optimal outcomes.